February is American Heart Month. It's a time to educate ourselves about heart disease and raise awareness, as it is the leading cause of death in the United States. And joining me is Dr. Harish Patlola, a cardiologist with Unity Point Health, along with Merritt Adams, a cardiac pulmonary rehabilitation manager. Thank you both for being here today.
Thank you.
Yes.
Thank you for
We're excited to talk to you because you're here to tell us, Merritt, about a really impactful a cardiac rehab program there at Unity Point.
Yeah, so Trinity was the first to offer this program in our area, the gold standard Pritikin program. And individuals who would benefit the most from this program have recently suffered a cardiac event, something like a heart attack, a stent placement, valve surgery, open heart surgery, and even heart transplants we get as well.
Okay, so this is just something important for people to know about. Obviously, nobody is expecting to have any of these heart events, right? Nobody is expecting to have a heart attack or have a stent replacement or anything like that. But doctor, just good knowledge for people to know, because if this does happen in their lifetimes, this is something that they would need, like a referral or something along those lines to participate in this program.
Yeah, anybody after a valve procedure or a stent or heart surgery or even heart transplant needs a referral from the cardiologist, and they go to Unity Point and they get the benefit. And
they participate in this program. You know, and I think it's not natural. It's not a natural path necessarily for somebody that is recovering from a heart event. So it's good to have this knowledge about the different programs that are out there and the different things you can do for yourself afterwards. So Merritt, talk about what makes this specific program so unique in its approach.
Yeah, so the Pritikin program has 3 different pillars that it covers.
Okay.
The healthy mindset, the supervised exercise, and also, and most importantly, the nutrition education.
Okay.
And at Trinity, we have a state-of-the-art nutrition center where our patients are taught how to read nutrition labels, how to swap ingredients, and even they can enjoy a live cooking school with our dietitian.
Yeah, that is huge because, I mean, many times, not all the time, I mean, you're the cardiologist here, you know, our eating habits, our nutrition are what sometimes gets us in the position where we are having heart problems in the first place. So it's not going to be common knowledge afterward to know exactly what types of foods you should be eating, what types of foods you should be trading out, and you have kind of this step-by-step guideline that's going to show you how to do this in your day-to-day life. So amazing there. And then supervised exercise plans. So you kind of touched on that, but participants in this program, they will have access to that?
Yeah, so we have, it looks just like a regular gym. We have exercise specialists and nurses that are watching the monitors. They come in, they exercise for about 60 minutes with that heart monitor on, which is the benefit of cardiac rehab.
Right.
Blood pressure checks are happening, medication management, and then we are a phone call away to CVM if there were any issues.
Wonderful. So everything is just done in a controlled environment, very safely. Doctor, so talk about how this program really does benefit a person with heart disease, or somebody like we talked about who has recently had a very serious heart event.
Sure. We know that about 80% of health actually happens outside of the medical office with lifestyle, and only about 20% actually happens inside the medical office with, you know, clinical care. So what the Pritikin program has had proven outcomes to reduce the risk of progression of cardiovascular disease, or slow the progression rather, and it reduces the need for, you know, further surgical interventions, reduces the medications that control cholesterol, high blood pressure, and diabetes. What the Pritikin program also offers is, you know, a comprehensive, supervised exercise program. On a consistent basis, we have seen great outcomes.
Yeah.
Apart from, obviously, you know, nutrition and healthy lifestyle mindset that they inculcate, as Merritt was alluding.
Well, yeah, but and it's really hard to change your entire lifestyle, regardless of if you had a scare like a heart attack or something along those lines. It just doesn't, as we mentioned, come super naturally to people. So it's nice to have this this path forward, so to speak. So Merritt, I'll start with you. Kind of what has the response been like from some of the patients that have gone through this program, you know, and in changing their lifestyles in this way?
Yeah, so they're with us for 3 months.
Yeah.
So it's a long time, and like you said, it's tragic, something happening like that. So graduation day comes and there are tears shed. We're very happy for them, and their, you know, longevity, looking at spending more time with grandchildren and different things like that.
Yeah,
So,
and I'm sure oftentimes on a path to being even more healthy than they were prior
Yes.
To this event. So, Dr. Heart disease, as we mentioned at the beginning of the segment, of course, it continues to top the list nationwide, and right here in the Quad Cities as well. So, talk a little bit more about who is at risk, just so that we can keep that in mind as we all move forward.
Yeah, heart disease continues to be the leading cause of death for men and women in the United States. And the good thing to know, it's largely preventable. Risk factors like age, gender, smoking, family history, poor diet, high cholesterol levels, high blood pressure, diabetes, obesity, being physically inactive, and stress itself. But you know, what we have to think about is most of these risk factors and diseases are easily treatable and preventable. And that you have to inculcate healthy lifestyle habits like eating fruits, vegetables, lean meats and whole grains,
Right.
Staying physically active, and you know, you need to change your lifestyle for a healthy you.
Right.
That's the more important part.
Similar to, you know, afterward and being part of this program, if you start to, you know, do some of those things now,
Yeah.
maybe you won't end up there. Well, thank you both. And if you want to learn more about the specific program that we talked about today, just visit Trinity Heart Center on the web at unitypoint.org. Merritt and Dr. Petlola, thank you so much for being here today and just sharing that wealth of knowledge with us. We appreciate it. Yes,
Thank you.
thank you.